One pivotal skill that may represent a developmental catalyst for subsequent social development is joint attention. So to quote a renowned researcher in this field, Michael Tomasello, he says that joint attention is not just two people experiencing the same thing at the same time, but rather it is two people experiencing the same thing at the same time and knowing together that they are doing this. So this is a very interesting phenomenon when we talk about the psychological theory behind this behavioral skill set. We think that this aspect of knowing is very important. This array of joint attention behaviors emerges somewhat like clockwork during the latter half of the first year of life, such that infants will begin sharing attention on an object in their proximal visual field with the caregiver around 8 to 8.5 months of age. So this is when you see an infant sharing attention with the caregiver. They're looking at an object, they look back at the caregiver to make eye contact, and they're sharing engagement and attention on this object in the proximal visual field. Around 9 to 10 months of age, infants will begin to reliably respond to a bid for joint attention. Now here the caregiver is redirecting the attention of the child to an object in the child's distal visual field, so outside of their immediate visual field. So most commonly this occurs all the time where an infant or a caregiver begins labeling information in the environment for the child. Look at the dog, look at the picture, look at the train, look at that funny looking car, these types of things. So these are all bids that caregiver uses to elicit joint attention with the child. And the next one of the most important steps of the sequence is when an infant, him herself, begins to initiate joint attention with a caregiver. And so this is just what you would expect. This is when the infant will redirect the attention of a caregiver to an object outside of the caregiver's immediate visual field. So what do we make of the psychology behind that's driving this behavior? Well, one aspect that has been talked about in the literature is this idea that the infant is acknowledging a difference between self and other. For example, they acknowledge that their visual system is separate from their caregiver's visual system, and perhaps that their mind is separate from the caregiver's mind. Okay? So when they see something cool and exciting and engaging and rewarding, and they want to reorient, they want to share this experience with their caregiver, they have to make eye contact with caregiver and redirect the attention and the mind of the caregiver to this object that is outside of their visual field. Now this could take two forms. Oftentimes we'll see infants requesting, they'll redirect the attention of a caregiver to request a cookie from the cookie jar, right? And this is less sophisticated than, say, the alternative, the second alternative in the sequence is where an infant will initiate joint attention simply to share engagement. And again, this is one aspect that Michael Tomasello argues is one of the most intriguing features or evolutionary products that is unique to the human condition. So we think that initiating joint attention is particularly important and an important catalyst for subsequent social development and the acquisition of sophisticated skills that include language, aspects of language development, various aspects of prosocial behavior, for example, sharing, and then we also think that it's important for very complex social behaviors such as empathic behaviors. Some individuals have argued that it's also very important for the emergence of consciousness. If you think about the level of consciousness and importance of consciousness and being able to differentiate the self from other. So here's an example of what initiating joint attention looks like.
Where are you going? What's that? Choo-choo.
So joint attention, which categorically depends on social interaction, represents a foundational element of subsequent development of sophisticated social behavior. As you can see in the video, the infant first initiates eye contact with the caregiver, and then will vocalize and gesture to reorient the attention of the caregiver to the object. And they initially share intention and engagement on the object before the experimenter grabs the object and delivers it to the child. Again, we think that this is very important behavior, a catalyst for subsequent social development.